Chargas disease, which is mostly known to be a silence disease, is caused by a parasite which is transmitted through insect vectors to animals and people. This disease day was first celebrated in 2020 and has consecutively been commemorated every 14th of April to raise awareness about Chargas disease. The report in details.
Chargas disease, also known as a silent or silenced disease, is caused by the parasite Trypanosoma cruzi, which is transmitted to animals and people by insect vectors found mostly in rural areas with high poverty.
Chargas disease is an infection caused by a parasite, and this parasite is usually transmitted through insect bite. We call it kissing bugs, where it can be transmitted through different routes, like blood transfusion, mother to child transfusion. It can also be transmitted through infected food and water. We have two stages of Chargas disease infection. There is the early stages and there is the chronic stages.
Meanwhile, on April 14th, the World Chargas Day is observed to raise awareness about this overlooked disease, to improve acute and chronic Chargas notification, as well as epidemiological surveillance of cases and active transmission.
It's a neglected tropical disease that usually not garnered any awareness, and it is a severe infection that is dangerous for a patient who especially is asymptomatic, or especially in a country like this where probably means of identifying the infection is very hard. We are trying to get awareness for the neglected tropical disease. There are few infections that are in that category. So, and the big ones are usually the HIVs, tuberculosis, and malaria.
Chargas disease can be either a sudden short-term illness, acute, or a long-term chronic condition. Although symptoms can be mild or serious, many people do not experience them until the chronic stage.
The treatment depends on the stages also. At the early stages, we can use there is actually a specific anti-parasite drug for it. At the early stages, this drug can be used, even in chronic stages. But at chronic stages with severe complications like heart failure and numbness, the treatment will be focused on symptomatic treatment. The most effective preventive measure will be vector control. That is the use of insecticide. Nets can be used to prevent being bitten by these bugs, and use of insecticide body spray. In terms of blood transfusion, in countries where this infection is endemic, the blood is usually tested for the parasite before transfusion or before being stored. And also awareness also is very important.
World Chargas Disease Day, on the other hand, should be promoted as a unique opportunity to add a global voice in favor of this and other neglected tropical diseases. Also, improving the rates of early treatment and cure, as well as interrupting the transmission of this neglected tropical disease, is essential to improve the rates of early treatment and cure.